Now we'll introduce an implementation framework for interventions that promote E.C.D. So what do we need to know about the implementation of our interventions? Firstly, we might ask, do we know our interventions are relevant and meet the needs of our intended beneficiaries, who may be in a rural community or a remote community or a low-income urban setting, or they may be in a fragile or humanitarian setting? Secondly, we might ask, are our interventions equitable? In other words, are they reaching all girls, all boys? Are they reaching all children irrespective of income, race, colour, ethnicity, religion? We may also ask, how well are our interventions working? There are many interventions out there. There are many good interventions where we cannot explain why they are good or how they are good. There are many not so good interventions, and we need to understand why that's the case. And then there are a lot of interventions which are somewhere in the middle, and they need a roadmap for how they can improve or get better. Therefore, what do we need to learn to effectively transition interventions from small to big? And what do we need to learn to effectively transition interventions from big to better? And importantly, how can intervention delivery be sustained? So what do we mean when we say implementation research? This is the study of methods to promote the integration of research findings and evidence into healthcare policy, as well as other policies of other sectors and practice. It seeks to understand the behavior of professionals and other stakeholders as a key variable in the sustainable uptake, adoption, and implementation of evidence-based interventions. In other words, implementation research cannot happen unless technical experts and practitioners and decision makers come together with frontline workers and the beneficiaries. We are trying to create a learning culture in our programs so that we can start to answer the questions that are important to us about scale, access, and quality. There are two dimensions to understand about how to implement early childhood interventions. The first dimension is about improving the implementation of interventions. This includes parameters of dose, which talks about the duration of a program, how frequently contact is made, and what the length of a contact or its intensity might be. We talk about delivery. What is the content of the program or the intervention that we're delivering? Who is delivering it? Could it be a health worker, a teacher, a mother leader? What is the mode of delivery? Is it individual or in groups? Are we meeting at home? Are we meeting in the school? Are we meeting in a community setting? And what is the theory of change that designs the delivery strategy? Then we talk about demand. Is there awareness of our intervention? How do we generate demand for E.C.D interventions? And are we ensuring that everybody is making that demand, including vulnerable groups? And finally, how do we measure whether our interventions are working? Is what we're measuring aligned to our theory of change? Are we measuring both outputs and outcomes that are predictive of later life outcomes? For example, can primary healthcare nurses delivering an intervention to promote early learning opportunities for infants when caregivers come to the clinic? So to answer this question, we might think about what dose is needed for caregivers to adapt and promote early learning messages. How can the intervention advice be delivered? For example, is it through counselling? Do we distribute pamphlets? Do we set up play corners in the primary healthcare centre? Do we put up posters or do we show videos? How can we generate demand from caregivers and from the clinics themselves so that this intervention is valued? And when do we evaluate? And once we start evaluating, what exactly are we measuring? In the second dimension, we want to understand not just what we're implementing, but how we're implementing it within a system, because it is the systems that help take our interventions to scale. So there are 6 strategies to take our interventions to scale. Firstly, adopting multi-sectoral intervention packages. Remember, E.C.D is not the responsibility of a single sector alone. Secondly, it is strengthening the system to deliver quality of care through a trained workforce. Workforce development is crucial. Thirdly, it is to broaden data and evidence systems. We treasure what we measure. Fourthly, it is to ensure that the costing and financing is available for sustainable and scaled-up program delivery. Fifth, are we advocating and communicating the strategies to build demand for early childhood interventions? And sixth, is there an enabling policy environment within the context that we're working? So again, if we follow through with our example using primary healthcare nurses to deliver an early learning intervention, we can ask, what training and supervision do these nurses need? How can this be delivered through the health system? What monitoring indicators do we need to have integrated in the M&E system of the primary healthcare service? And can the intervention be supported with a media campaign? Remember, it takes time to incrementally improve the quality of our intervention and to continue to allow the intervention to evolve, to respond, and to adapt to the changing context that we are working in. So how do we learn about delivery at scale, especially in the complex systems that we're working in? The ability of innovation at scale is driven by 6 factors. First of all, we need to understand the attributes or the characteristics of the services that we're working in. That is, those platforms. Secondly, we need to understand the attributes of the people delivering the interventions, the implementers. Thirdly, we need to understand the delivery strategy itself, whether that's groups, individual contacts, or other forms of contact, such as a media-based delivery. We need to think about the characteristics of the community who is adopting, taking up the intervention. And we also need to understand the wider environment, the social context, the political context, what policies are available or missing which might support children's development, and what evidence is locally available. All of these articulations, workarounds, and muddling through that keeps the show on the road are not footnotes in the story, but are central to its plot. They should be carefully studied and represented in all their richness. To achieve system-level change, complexity-informed approaches to implementation would need to depart from a narrow focus on just looking at the fidelity of our intervention to embracing effective adaptation and tailoring to context, working in partnership with stakeholders, and viewing implementation as an iterative, recursive, and long-term process. We must embrace the complexity. So our take-home message is that implementation is an iterative and collaborative approach to improving our interventions in real-world settings. We need to work together, we need to be actively engaged and critically reflecting the changes in the programs and in the environments that those programs operate in.